The Doctors Without Borders nurse quarantined at a New Jersey hospital is planning legal action to get out of isolation. Kaci Hickox is a 2002 UT Arlington grad. She's hired as a civil rights lawyer now. She was working with Ebola patients in Sierra Leone. She tested negative for the virus, but is being held under a state-mandated 21-day quarantine. She says she's living outside in a tent with no shower, plumbing, air conditioning, or heat. She calls it inhumane. Others say her situation could impact aid.
If we just start putting people in tents with no AC and a window and don't let them talk to anybody, no one's going to want to go to West Africa to help.
If people in other states had said, we're not going to Dallas because, oh, they have Ebola in Dallas, it will harm our reputation, but more, it will harm our economy.
New Jersey Governor Chris Christie says it was his decision to keep Hickox in isolation. She says health officials should be making policies related to Ebola, not politicians.
One of the country's top experts in infectious diseases says there's no reason to quarantine healthcare workers returning from West Africa. New Jersey, New York, and Illinois ordered those people be kept in isolation for 21 days. The Illinois order also covers high-risk travelers. The fear is that sorely needed volunteers will not go to Africa if they face quarantine.
There are other steps that you can protect American people based on the scientific evidence that does not necessarily have to go so far as to possibly have unintended consequences of disincentivizing healthcare workers.
The president met with his so-called Ebola czar at the White House this weekend and asked for guidelines for returning healthcare workers. A UT Arlington graduate under quarantine in New Jersey threatening to sue to win back her freedom.
That nurse is being held under that state's new isolation policy, and Fox 4's Jenny Anchondo joins us with more. Jenny?
Yeah, and you know, a lot of complaints about the conditions here specifically. Kaci Hickox says that she is living outside in a tent with no shower, no flushable toilet, air conditioner, or heat. So she returned Friday from a trip to Sierra Leone with Doctors Without Borders, where she worked with Ebola patients there. Hickox is being held because of this new policy in New York and New Jersey. So initially, both the governors of New Jersey and New York announced that they would isolate all travelers returning to their states from Ebola-stricken countries who had contact with infected patients. Now, Andrew Cuomo is loosening the quarantine orders in New York, saying that they can be monitored from home, not necessarily a government facility. Still, a top federal health official says that a mandatory quarantine like this can have the unintended consequence of discouraging people from volunteering, and that we really need those workers from the U.S. to help in the fight. A local doctor contends she put her life on the line and should be treated with more dignity.
Have to have a nice facility with all the proper amenities of American lifestyle, running water, air conditioning, access to telephones and internet for these healthcare workers. These are heroes. These aren't prisoners.
The 2002 UT Arlington grad says that her lawyer is planning legal action to get her out of isolation. A hearing on that is expected to happen by tomorrow. And a lot of you have been speaking out about this on Facebook. For example, Jeff Thorpe wrote in, I understand people go for a humanitarian reason, but they should plan on a stay in isolation when they come back. Remember, the doctor in New York tested negative when he got home, only to be found infected a week later. And then Alexandra wrote, it is ridiculous she has to live under the circumstances for 21 days. She should be in an actual building. They should have some sort of area for Ebola patients there, or something outside, something other than outside. She also says, I don't disagree with her being quarantined, though. We need to have to be safe, not sorry, and get other people infected. So we're curious what you have to say about this. A lot of people speaking out on the Good Day Fox 4 page if you want to join that discussion. I'm Jenny Anchondo for Good Day.
A nurse who recently returned from Africa may sue to get out of mandatory quarantine.
She is being held in New Jersey, and Fox 4's Jenny Anchondo is here with more. Jenny?
Yeah, Lauren and Tim, Kaci Hickox says that the conditions are really the problem here. She's living in a large tent outside without a shower, flushable toilet, or climate control. She returned Friday from a trip to Sierra Leone with Doctors Without Borders, where she worked with Ebola patients. Hickox is being held because of this new policy in New York, New Jersey, and Illinois. State leaders there say that they will now isolate all travelers returning to their states from Ebola-stricken countries who had contact with infected patients. New York Governor Andrew Cuomo is loosening quarantine orders there, saying that they can be monitored from home instead of at a government facility. Still, a top federal health official says that a mandatory quarantine can have the unintended consequence of discouraging people from volunteering at all. And he says that we really need those workers right now from the U.S. to help in the fight against Ebola. A local doctor contends she put her life on the line and should be treated with more dignity.
So I don't necessarily disagree with the notion of placing healthcare workers under quarantine for 21 days. I'm okay with that. But the means and the way they put Kaci under quarantine, I'm not okay with. You have to have a plan. You have to.
The 2002 UT Arlington grad says that she hired a civil rights lawyer who is planning legal action to get her out of isolation. A hearing is expected to happen on that by tomorrow. Here's what some of you have been saying online about this. John writes, she proudly goes to foreign countries to help others, but she's unwilling to spend 21 days in isolation after she returns to make sure she doesn't make people sick here. Seems selfish. And then Esmeralda and some other folks have been talking about the flu and making a comparison here. She writes, I'm surprised at how people are reacting to Ebola when more people die from the flu every year. I think if you want this nurse to stay in isolation, then during the flu season, if you get the flu, you should be forced into isolation until you are no longer contagious. A lot of chatter online about this. If you'd like to join in on it, you can go to the Good Day Fox 4 Facebook page and join in on that discussion. I'm Jenny Anchondo for Good Day.